Sorry I'm late. My name is Dr. Gustavo. I believe you're Brittany, right? Yes, that's me. So, I hear you're 26 weeks pregnant. How's that going? Yeah, I am. It's actually going pretty decent. However, I do keep getting these headaches, and I've been having a lot of pain in my stomach, and my urine has been foamy and bubbly, and I do not know what's going on, so I thought I should come check it out. Also, the doctors told me a couple days ago that my blood pressure was 168 over 94, so I didn't know how worried I should be. Well, you shouldn't be too concerned, Brittany. In a healthy, normal pregnancy, blood volume will increase. The plasma of the pregnant woman will increase at an average of 1,250 milliliters. I know it sounds crazy, right? It's a little less than 50% of a non-pregnant woman. The first trimester is the least of the increase. By the time you hit 34 to 36 weeks, your blood volume should reach its max, though. After this, little to no increase should occur. This increase can all be determined, however, by the size of your baby or by how many babies you're pregnant with. Not only does the increase happen in your plasma, but it does in your red blood cells as well. See, it increases by less, being around 250 if you're not taking any iron supplements. If you are, it can increase approximately 400 to 450 milliliters. Because you are pregnant, your heart at rest is working 40% harder. Most of the increase is due to the more efficiently performing heart, which ejects more blood at each heartbeat. So that kind of explains why the blood volume is increasing and the blood pressure is higher. Oh, okay, that kind of makes sense, I guess. So, is that why my pee's bubbly, or is that something else? Well, no. I'm sorry to say it's not. I think you might have something called preeclampsia. Have you heard of that before? No, I don't think so. What's that? Well, preeclampsia is a condition that pregnant women develop. It is marked by high blood pressure in women who have previously not experienced high blood pressure before. See, two major signs of preeclampsia are having a high blood pressure and protein being present in your urine. This really helps to explain your frothy pee because the protein actually causes it to be foamy due to the concentration. It's good you came to see me because people often self-diagnose themselves as having kidney disease. Yikes. Oh man. So, will this affect my baby? Well, since preeclampsia affects the blood flow to the placenta, it can lead to your child being smaller or even premature. Sadly, that isn't the worst case scenario. It could also lead to serious illnesses in your child, which could cause its future death. But that is worst case scenario. So don't be scared just yet. But let's talk about your blood pressure again. Your cardiac output will increase by about 50% during your first trimester due to your blood volume increase. And by your second trimester, your cardiac output rises from 4 to 7 liters. Sounds kind of like a lot. This is all, however, just to accompany the change in your blood volume. It's nothing wrong with you. It's just because of that change. So, do you have any more questions? Actually, yeah. I was wondering what happens with the size of your uterus. I heard it becomes the size of a watermelon and stuff like that. And I was like, oh my goodness. And I know I could look this up at home, but I figured since I'm here. Oh, no need to explain yourself. I'd love to tell you. Well, before you're pregnant, your uterus is around the size of an orange, and it's situated deep within your pelvis. However, when you do become pregnant, that uterus acts like a balloon and it blows up, then contracts. During your first trimester, it turns to the size of a grapefruit, and it begins to grow up and out of your pelvis, but it still fits within it. By your second trimester, your uterus will grow around the same size of a papaya. At this point, it will no longer be able to fit in your pelvis and will be situated midway between your navel and breast. As this growth occurs, your organs will begin to shift out of place, and they begin to push tension around your surrounding muscles and ligaments. When you finally reach your third trimester, your uterus will finish growing and will be the size of a watermelon. When you reach your full term, your uterus will expand from the pubic area to the bottom of your rib cage. Yikes, that sounds painful. Man, that thing expands a lot. And the beauty of the body is that it allows it to shrink back to normal, like the balloon example I mentioned, to the size of an orange and position back in the original place deep in your pelvis. This is called involution, and it usually takes about 6 weeks, give or take. Wow, pregnancy changes your body so much. I didn't even realize. Like, I mean, I know you got big, but a lot of people get back small again. So I didn't really think of all the inside stuff, if you get what I'm saying. Yes, I understand what you're saying. So, does that explain why I've been having to pee a lot more lately? Like, is it because of the expansion of the uterus? Is like, because you said it puts pressure on your organs. So, I'm trying to get like, is that why? Or, yes, that's actually why. See, the bigger your uterus gets, the more pressure you put on your bladder. So, it causes you to pee more. Yeah, you're right, basically. So what other problems should I expect due to it expanding and pushing on my organs? Is it just a pee, or can something serious happen, or is it just all normal, lily dotty? Well, yeah, it is normal, but you shouldn't expect anything too bad. It should stay in the boundaries of having normal aches and pains. Your organs do move, so I'm sure you'll feel that a little bit, but it shouldn't be to a horrible, unbearable point. It may also cause your navel to stick out a little bit, but normally after birth, that goes away. Oh, okay. Doesn't sound too confusing or too bad, I guess. That's good. Do you have any more questions? No, I don't think so. Okay. I'll see you next week for your appointment. All right, thank you, Doc. No problem.